Do you want to jumpstart your innovation? Applications are open for the 2022 Rosamond Innovators Program. Connect with people who can speed up your scale-up in health tech. Subject matter experts, clinicians, partners, and investors. Deadline to apply is April 11th. Visit rosamondinstitute.org to learn more.
We landed on mental health as a way to engage. And that's for a simple reason in our mind. At any given point of time in one's life, you would experience stress, anxiety, and at some episodic times, even depression. And so thinking from an engagement point of view, and that was way before pandemic time, where before people understood that it is necessary to destigmatize mental health, we really thought about mental health in a broader context.
And now, from San Francisco and the UCSF Rosamond Institute, the Health Technology Podcast with your host, Christine Winoto.
Despite what your mom tells you, not all computer games are bad. Our guest today, Ofer Leidner, is proof of that. His company, Happify Health, uses the software science behind computer games for a good cause, healthcare. Ofer is currently the CEO and founder of Happify Health. He's also co-founded many other digital media companies, including Oberon Media. And today, he talks about how your mind can affect your health, for better and for worse. Here's our conversation. Well, welcome, Ofer. Thanks for joining me today.
Christine, thanks for having me. Glad to be here.
I'm so excited for our conversation. I thought it would be good for our listener to start with a little bit of your personal background and the journey that you took to get to where you are today.
Great. Happy to share a little bit of my background. So I grew up in Israel, moved here about 21 years ago with my previous company. Ended up kind of coming to healthcare from what I would probably say a non-traditional background prior to starting Happify Health. I was a co-founder of a fairly large casual game, social gaming company back in the early 2000s, first generation social game, downloadable games, mobile games, then iPhone games. And through that company, and which we grew fairly quickly, we had about 60 million monthly uniques on the platform. Mastered the art of behavior change and realized that if we can drive behaviors in gaming with so many people at that scale, it's a very powerful ability to leverage technology. But one thing I didn't actually like is the addictive nature of those games. I really didn't like the idea that we can get people to come and do things that we want them to do on the device 8 times a day, spending many hours with us on that platform. And so about 8 years into that journey, the company was already fairly large. We looked at usage data and realized that people spend 21 billion hours a year with us on the platform. When we divided this number into the 60 million monthly uniques that we had on the platform, we realized that we're wasting 14 days a year on average for each gamer. And nothing wrong with gaming. I love gaming. I think that it's nothing wrong with entertainment. But I had a sense that if we can actually take that kind of expertise that we mastered in behavior change loops, and try to bring it towards slightly healthier behaviors, there will be something for us to work on, and something that my co-founder and I got interested. So that's my background: consumer grade technology, user centric, patient centric. How do we drive behaviors using technology? And then when we kind of went into starting to think about better applications for that set of expertise, we landed on healthcare quite naturally. This was before digital health and digital transformation was so clear, definitely post pandemic, but really kind of got interested in this idea of bringing the technology, behavior change, design, consumer centric design, married with evidence based science, and try to kind of engage as many people and drive healthier outcomes. At that time, I kind of also had my first kid, and I started kind of realizing that if we don't change course with how we use technology, we might seeing the kids that we see today glued into screens, and essentially that wouldn't be the best use of time, most purposeful use of time. So that's kind of the journey. I've been entrepreneur. This is my third company. Started my journey, spent a couple of years in management consulting, then early stage investments, but really wanted to build and explore ideas that can find markets and opportunities to help something more meaningful.
I'm glad that you shifted. I mean, as a mother of a teenager, game is always like seems to be our enemy. I think you talk to a lot of parents, and it's interesting you're mentioning about how the game industry, you learn certain behavior can drive interest or continuous interest into your product that create an addiction. And I'm sure the more addicted people are, it's better for the revenue. Can you share with us, like, what are the certain behavior that you learn for a human to get them engaged? That's important to make them engaged to with your product. Like, what are the things that get people like hooked?
So the formula in gaming is fairly simple. You use color palettes, you use sounds, you use level design, you use all of those very well mastered mechanics to ultimately infuse dopamine in the brain. It's as simple as that. You want to create stimulates, you want to ask for an action, you want to reward, and if you do it enough time along a level progression of a game, you could actually drive addicting behavior and really kind of fool the brain to really seek for that dopamine in the next move. Now, when you start thinking about that kind of behavior, the insights for what we built and created in Happify over the years was this idea that what if we can tune down the level of engagement, and really, rather than trying to bring people 8 times a day, really think about something that is there for them to support certain types of clinical protocol journeys that they have. And that's kind of what we've done. A lot of the core concept in gaming, we actually decided to tune down. So, for example, there is no place for competition in healthcare in our experience, right? While in gaming, a major driver for behaviors is leaderboards, for example, right? How am I doing compared to my peers? In healthcare, if you try to put that front center, you're most likely not going to get the best engagement. So all of those mechanics and color palettes and all of those kind of well-known and understood mechanics that have been optimized to death in gaming, we thought that there was a better use for them. And ultimately, what we've done with Happify and the journey that we've done there was really kind of taking those concepts, tune them down, and starting to think about how do we marry them with evidence-based science. Interventions that were sitting in the ivory tower academic research labs, and really kind of how do we externalize them? How do we leverage the power of technology to disseminate them at scale? One of the core themes that we got interested in as we started thinking about engagement of patients with healthcare was about what's the common theme that we can engage people, whether they understand it or not, but something that in our mind was the broadest common way to engage people. And we landed on mental health as a way to engage. And that's for a simple reason. In our mind, at any given point of time in one's life, you would experience stress, anxiety, and at some episodic times, even depression. And so thinking from an engagement point of view, and that was way before pandemic time, where before people understood and that it is necessary to destigmatize mental health, we really thought about mental health in a broader context. The first context was really, hey, can we actually help address this as a primary indication, help people reduce stress, anxiety, and depression? That's interesting. The second dimension was how can we, when that is happening, if we're able to incorporate evidence-based science, CBT, other mechanism of actions, what happens to other health behaviors when people feel better? When you feel better, are you more adhering to your medical protocols? Do you tend to take a better advice from your physician? So the impact on mental health on behaviors. And then the third dimension, which I actually was most attracted to, was what is the real connection between body and mind, and what happens in our physiological body systems when we're actually treating and supporting people with behavioral interventions. We often hear about many diseases that are triggered by episodes of stress, anxiety, and sometimes depression, autoimmune diseases, skin disorders, cardiovascular diseases, oncology, cancer journeys. And there's a very clear kind of definition and connection, physiological explanation about, how you could leverage behavioral intervention to address those kind of indication. And that was the area that we got most fascinated in kind of thinking through a broader context of mental health beyond the indication. Hey, let's help people feel less stressed, less anxious, less depressed. But let's really study the connection in a clinical kind of setting of the impact on behavioral intervention on different indications in disease areas that we're interested in. So that's kind of the journey we brought on board probably the most multidisciplinary team that I've ever worked with. Game designers sitting next to clinicians, next to AI folks, next to technology platform people, next to content experts. And really kind of the one common theme that was common between all of those people, they were passionate about this mission. Hey, can we build an end-to-end clinical grade platform that really kind of take this mechanism of action of mental health and really explore how far we can bring it to market, both on the concept of mental health, but also the mental health as a comorbidity that is an underlying condition for most physical conditions. So that's kind of the journey.
Yeah. So, I mean, does that mean that you're saying for different disease condition that people experience also mental health challenges? Is the treatment different based on different disease condition, or it's kind of you view it as is all mental health?
Yes. So what we've built over the years is a clinical grade technology platform that ultimately builds both digital therapeutics and care journey experiences. We can talk about our view about patient-centric healthcare, but putting those together, we're really kind of trying to ultimately use technology to shorten the gap between need and care. So can we use software as medicine? Can we use those principles that allow us to arrive to clinically validated product at scale to solve some of the healthcare challenges? The approach that we've taken with this platform is essentially to build a set of horizontal services which allows us to kind of address wellness applications, AI coach that is trained per specific disease, care journey solutions. Think about this as a community, all places for patient in a single disease, all the care that they need in one place, and then digital therapeutics. And essentially that horizontal capability that we've built on a platform basis allow us then to go and verticalize it into disease areas that we're interested with a unique implementation of those tools and services on the platform for specific needs. So, for example, we recently kind of published a study of real-world evidence study about the impact of behavioral interventions on migraine patients, which many kind of studies made a clear connection between stress and anxiety and migraine pain. That there's a whole kind of physiological explanation, I'm happy to dive in. But for the non-clinical audience, I will save it. But the basic idea is that if you are able to reduce anxiety and depression, anxiety and stress with migraine patients, we not only found that we're able to reduce those kind of depression, anxiety, we also found that we're able to reduce migraine pain and able to reduce migraine days, so frequency between kind of migraine attacks. Another example, we've long been interested in MS as a neurological disease. People living with MS, we do know that the vast majority of those will experience depression, both organically and also as kind of result of a difficult journey. We were able to demonstrate that with the type of behavioral interventions that we're kind of offering and the kind of context that we're setting in that journey for those patients living with MS, we're able to reduce fatigue, which is a biomarker of the disease. Now, if you're looking at the pharmacological solutions for MS, for patients living with MS, very large market, $26 billion market, and yet not a single pharmacological solution that address an indication and a biomarker of the disease around fatigue. So we were able to do that. And ultimately, the way our platform works, we can do it across different conditions. We have interest in skin disorders, asthma, migraine, cardiovascular diseases. We've done work with the American Heart Association. That's the approach. It's the same set of interventions, but applied in context and studying different endpoints in each of those kind of solutions.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
How hard, how challenging it was for you to scale it, with the same concept for, say, for migraine patient, for MS, and how different is it for each one of different disease condition?
Yes, so we are, I call it a 9 years in the making. What kind of we discussed a little bit, no overnight success in healthcare. You've got to be fully committed to the journey. There's no shortcuts if you're aiming at healthcare, right? I mean, you need to build a product, make sure that users are engaging. You have the longitudinal data to show that. You have to run randomized controlled studies. You've got to demonstrate to your client, customers, partners that you work with that the solution works for them. No shortcuts. One of the key, I think, things that make us different in the marketplace is that we really thought about a framework from a platform point of view first, and then once the platform was ready and we studied the framework of this platform, do we have the set of interventions that consistently, no matter if we study on younger population, older population, chronic condition population, CADE population, do we see the consistent outcomes if those interventions are applied? Once we studied that, there was a whole group which kind of we added to the company about 2.5 years ago that really builds the more clinical solutions on the platform. This is, we call them specialty solutions. Those are anywhere from non-prescription digital therapeutics, those who are kind of built still on a quality management system, enforcement discretionary. So those are governed by the FDA, but do not require registration. Those applications, deliver claim level of management of symptoms. So we can manage symptoms of MS. We can manage symptoms of patients with a condition. And then next to those, we're building set of applications which are prescribed digital therapeutics. Those need to be certified as software as medical device, 510K, de novo. But really, it is the platform that we invested so many years in building and validating that allows us now to industrialize the pace around the solution and healthcare challenges that we're looking to solve for. We're very interested in women's health. We have several deployments in women's health. Very interested in skin disorders, asthma, cardiovascular.
It's interesting because I feel like you're building something that's like almost like a plug and play, just like put one more for different disease condition, and then as you go, and then you add another one. So that's kind of it make it so flexible in a way.
So the approach that we've taken is a platform play and kind of allow for configurability. We call those kind of solutions that we put using those set of services that we built on the platform. We call them sequences. So essentially, think about it as a clinical sequence to support a journey of a member around a disease area or a condition. When we put those together, we really kind of piggybacking of years of platform investment. So yeah, we don't write code for new for new disease areas or conditions that we're supporting. The other thing which is interesting about the way we were thinking about it is that a lot of people are thinking that healthcare needs to be completely rewritten, right? From kind of the delivery system and how that kind of works, and kind of let's build it all. Let's we don't care about the incumbents, and let's just build it brand new. And our approach from the get-go was, and we went through a journey, by the way. This is we landed in that place. We didn't start there, but we kind of thought that I don't see the payers disappearing from the equation anytime soon. I don't see the pharma companies disappearing from the equation anytime soon. I don't see providers, large kind of provider systems, disappearing from the equation anytime soon. So that everything that we built on a digital kind of transformation, digital health, needs to be completely configurable to support and essentially drive value to patients first, always patient-centric, and then to the partners that we work with. So we work with, 3 out of the 5 national health plans using our services in different disease areas. 7 out of the 20 big pharma companies are building solutions that kind of using the platform services. We really kind of see ourselves as solving some of the kind of challenges, but not all of them. And when we don't solve some of the components, we really work closely on what we call federation of networks, right? So we are in the software business. That's what we know. Software is medicine. We know how to engage members. We know how to drive them into software-driven, AI-driven care. But that's not the only care that patients, members need. Sometimes, often more so the case, they will need to meet physicians. They will need to meet other clinical providers. Our view is we just want to make sure that those folks can be easily integrated into this journey, into this kind of precision care stack, we call it. And let those people really treat and kind of care at the top of their license, where software will treat those who can be treated through software, much more scalable, cost efficient. And if you have engagement, then you can prove that it seems to be working.
Mm-hmm. Bring us back to when you first started. I'm just thinking now that you have so many different, like reconfigurable, with adding on so many specific diseases. In the beginning of the journey, I often see when a company just started, the investor was like, well, that's too narrow, or that's too generic, too broad. And how do you overcome that? Because I think when you said you focus on building the platform first, and people were just saying like, well, that's, probably like, who's the market? Like, where's the market? It's like, so how do you overcome that?
Yeah, it's a great question. So we kind of, while we always thought about the problem that we're trying to solve is a platform solution to solve, we decided to start with a very narrow application. Only later it became like a giant opportunity for itself. But let's see if we can reduce stress, anxiety, and depression in a clinical, evidence-based, validated fashion. So that was the first approach. We knew that the set of interventions that we're putting together, the repository of evidence-based interventions, CBT, positive psychology, mindfulness, about 8 different mechanisms of actions that are validated, tested. We do not invent new science. We transform and translate science into software, engaging software solution. But that was the first goal that we had. Can we actually, in real world setting, in randomized control environments, demonstrate that we can reduce depression, anxiety, that people would use the product, and that it would deliver the value and better care, more efficient, scalable care. Once that was there and we knew that that primary indication, we know how to repeatedly deliver it, we kind of went into question number 2 and 3. What type of behaviors do I see when I reduce, were we able to reduce depression, anxiety? Do we see people more adhering to their medical protocols? Do we see people more adhering to their kind of drug adherence? We have a huge problem. People, they get prescription and they don't always just follow the clinical protocol. Is there an impact there? We then say, okay, but now let's look at disease areas that really have very strong ties and connection, literature, validated beyond any doubt, the connection between the mental health and the physical health, right? So if you're thinking about the reason why this works across many conditions, it's not necessarily because the way we wrote the platform and developed the platform. It's because the science suggests that our brain is being the command and control unit for our central nervous system. Nervous system being the one activating all of our physiological systems. You can calibrate if those systems are thrown off because of stress and anxiety. You could start seeing many parts of our body, many systems in our body behaving in a way that generates diseases. So the evidence, the clinical evidence for that replicability of the approach was there. The platform thinking was from the get-go. We want to design. We're platform people, even in our gaming world. We never wrote code for applications. We wrote the platform and then configure the game, configure the therapeutic in a very flexible way. And really kind of once we saw the success with the mental health, we said we can actually apply this exact same approach to, today about 10 conditions that we're working with different partners.
I know it's like almost close to our time, but I want to ask you one question. So this is Happify is your first healthcare company. What lesson that you learned from the gaming industry that you thought would be helpful for the healthcare company, it turned out to be not the case?
Oh, there's so many things that I've learned to be not the case. As you know, healthcare is I often, my partner and I always joke and say that had we known everything we know today on healthcare, who knows if Happify Health would have been born. And kind of more seriously, we moved from the probably one of the fastest moving industries, right? In the gaming industry, you build a game in 3 months, you launch it, agile prototyping, you see if it's working, great. When you move to healthcare, you deal with a kind of a complex system to begin with. You're dealing with clinical world, so it's at any given time somebody can come and say, show me the data that what you have produced clinical evidence. You have to take the time to do it. So I think lesson learned for me was you really need to come baked with your decision that you're pursuing a purposeful kind of journey. If you're not there for the authentic reason, you want to help improve people's life, you want to help solve for challenges that have to do with health, you will be crushed by this industry slowness, sometimes complexity, sometimes conflicting interests of entities that are playing in the ecosystem. So you have to be willing to dedicate the time and kind of be very purposeful in how you're thinking about it. That's lesson number one. Lesson number two, um, have a pretty good plan of where you're trying to make the impact. What's the go-to market that you want to pursue? We began our journey simply from a direct to consumer because that's kind of the world that we're starting. Little did we know when we started that the consumer behavior in healthcare does not really suggest that we're primed to take our credit card and just pay for our healthcare, right? It's my provider, my healthcare insurance provider, and I see a lot of companies spending too much time working unit economic, working all of those things that ultimately are not really the path that they go. And then they go back and say, okay, we should go after payers, we should go after providers. So have a really good game plan of why you're spending time with consumers. I think it is, in hindsight, one of the most important things that we were able to do is spending the time with consumer and really work the product, validate that it's working in real world, optimize engagement. We have today our retention rate for cohort months 36 is over 30%, which is kind of best in class in consumer grade internet. We wouldn't be able to achieve that had we not been naive to think that we will solve the direct to consumer model. Luckily, some of the investors and people that we met here in the company said, guys, you've got an incredible vision, but go to market is not not how you go to market. So really kind of I call it measure twice, cut once in terms of understanding your go to market and what are the implications of you choose to go employers, major implications of what type of company you're building. You choose to go health plan. What's the sequence? Why are you going? And what are the requirements for you to be even a candidate to go work with a payer? You choose to go with pharma, different type of complexities, regulation, compliances. Uh, so really kind of be thoughtful about what's your game plan and how you're going to bring your innovation, your product to market. That's lesson number two. Lesson number three, I keep learning every day, and you got to be open to learn and adjust and adapt. That's probably true to any level of innovation and kind of entrepreneurship, but in healthcare specifically in this time where we really are rewriting many of the foundational layers through this healthcare transformation, through this digital transformation, you have to be flexible. You have to have the North Star, but you have to be very flexible in how you think about the opportunities, the market change, legislation changes. You just have to be passionate about solving for the problem you're solving for, and bring a lot of good people that know the industry. That's another maybe lesson learned. By definition, I don't know much about, FDA, clinical trial requirements, but I need to bring the best people that I can attract as an entrepreneur that bring that domain. And so you have to accept the idea that you don't know everything. You have expertise in some areas. You have to build multidisciplinary team. That's, if you, and I've seen some entrepreneurs that think they know everything. It just doesn't work in healthcare by design.
Yeah. So from what you're saying, the naiveness about understanding consumer, it worked out really well, even though you were saying that going direct to consumer probably is not the best route for consumer health, but actually when you first think about it, allow you to really understand the patient centric, the consumer centric.
Yeah, I think that spending time with consumer is a must, right? If you build a product that ultimately consumer will use, but we probably spent 2.5 years and grew to 50,000 paying subscribers to our service, which, completely unnecessarily. So in hindsight, obviously. So yes, it helped us understand and build capabilities that the company uses today in our enterprise world. But I probably could have shaved a year to a year and a half from that journey. I think that spending a year testing, validating, optimizing your product is probably what we could have done better. But again, I go back to healthcare takes time, requires patience, requires deep commitment to the mission that you're kind of standing behind. And in hindsight, it's all a learning experience, and people need to approach it as such.
Yeah, well, you guys been doing great, making great progress, and thank you for sharing your story, your insight, and your lesson learned. And good luck. I think you guys are doing great things.
Yeah, thank you, Christine. Great to have this chat with you. Thank you.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.